I want to talk to you today about something that can be genuinely important and that should never be ignored. Suddenly feeling short of breath when you're at rest, doing nothing strenuous, and what this unexpected breathlessness can mean, particularly for the heart and lungs. Because we expect to be breathless after exertion, so becoming short of breath while sitting quietly or doing very little is unexpected and unsettling, and it's a symptom that genuinely deserves attention, since sudden breathlessness at rest can signal a heart or lung problem, sometimes an emergency, so understanding it is genuinely important. So today I want to explain why you can become breathless at rest, the heart and lung causes, which situations are emergencies, why this matters, and what to do, with the crucial emergency message in partnership with your doctor and emergency services. And I'll be clear and direct, because while occasional mild breathlessness can have benign causes like anxiety, sudden or significant breathlessness at rest genuinely warrants attention, and certain features are emergencies, so knowing this can save your life, in partnership with emergency services. This is about recognizing an important symptom that should not be ignored. Let me start with why becoming breathless at rest is significant, because it frames everything. Becoming short of breath at rest, when you're not exerting yourself, is significant because, unlike breathlessness on exertion, which can be normal, or from being unfit, breathlessness while sitting or lying quietly means your body is struggling to get enough oxygen, or your heart or lungs aren't coping even at rest, which is more concerning. The heart and lungs are responsible for getting oxygen into your blood and circulating it, so breathlessness at rest can signal a problem with either the heart not pumping adequately, as in heart failure, or a lung problem, among other causes. So unexpected breathlessness at rest deserves attention as a possible sign of a heart or lung problem, more so than exertional breathlessness. So breathlessness at rest is significant because, unlike exertional breathlessness, it means the heart or lungs aren't coping even without exertion, signaling a possible heart or lung problem deserving attention. So understanding that rest breathlessness is more concerning than exertional is the foundation. So breathlessness at rest deserves attention. So rest breathlessness is a significant symptom. Let me give you the heart causes, because they're central. Several heart problems can cause breathlessness at rest. Heart failure, as I've discussed, where the heart doesn't pump efficiently and fluid backs up into the lungs, can cause breathlessness, which in more significant cases occurs even at rest, or on lying flat, or wakes you at night, as I've discussed. A heart attack can cause breathlessness, sometimes as a main symptom, especially in older adults and women, with or without chest pain. Heart rhythm problems, like a sudden fast or irregular heartbeat, can cause breathlessness, and other heart conditions can too. So breathlessness at rest can signal heart failure, a heart attack, a rhythm problem, or other heart conditions, making it an important possible heart sign. So heart causes of rest breathlessness include heart failure, heart attack, rhythm problems, and other heart conditions, making it an important possible heart sign. So the heart causes are central and important, so rest breathlessness can signal serious heart problems. Let me give you the lung and other causes, because they matter too. Breathlessness at rest can also signal lung and other problems. Lung conditions, like a flare of asthma or COPD, pneumonia or a chest infection, or other lung problems, can cause breathlessness at rest. A blood clot on the lung, a pulmonary embolism, which I've touched on, can cause sudden breathlessness, often with chest pain, and is a serious emergency, sometimes following the leg clot I've discussed. Severe anemia, the low blood count I've discussed, can cause breathlessness. Anxiety and panic can cause breathlessness, though this should be a diagnosis of exclusion, not assumed, and other causes exist. So breathlessness at rest can also signal lung conditions, a blood clot on the lung, severe anemia, or anxiety, among others, so it warrants proper assessment to find the cause. So lung and other causes include lung conditions, a lung clot, anemia, and anxiety. So rest breathlessness warrants assessment to find the cause. So lung and other serious causes matter too. So rest breathlessness has serious lung causes as well. Let me be very clear about the emergency situations, Because this is crucial. Crucially, certain breathlessness at rest is an emergency. Seek emergency attention, calling emergency services. 4. Sudden severe breathlessness, or breathlessness that comes on suddenly and is severe or doesn't settle. Breathlessness with chest pain or pressure, which can signal a heart attack or a lung clot. Breathlessness with bluish lips or face, severe distress, or feeling you can't get enough air. Breathlessness with fainting or collapse. Or breathlessness with the frothy or pink-tinged phlegm of severe heart failure. These can signal a heart attack, severe heart failure, a blood clot on the lung, or other emergencies needing immediate care. So sudden or severe breathlessness at rest, especially with chest pain, bluish lips, or collapse, is a medical emergency. So treat sudden or severe breathlessness at rest, especially with chest pain, bluish lips, severe distress, fainting, or frothy pink phlegm, as an emergency and call emergency services immediately. So know the emergency breathlessness situations. So sudden severe rest breathlessness is an emergency. Let me explain why this matters so much. Because it should never be ignored. This matters because sudden breathlessness at rest can be a sign of serious, sometimes life-threatening conditions. A heart attack, severe heart failure, a lung clot that need urgent treatment. So recognizing it and acting promptly can be life-saving, whereas ignoring or downplaying it, or assuming it's just anxiety or getting old, could be catastrophic. Even when not an immediate emergency, new or significant breathlessness at rest warrants timely medical assessment to find and treat the cause. So breathlessness at rest should never be ignored, since acting on it can catch and treat serious conditions and save lives. So this matters because sudden breathlessness at rest can signal life-threatening conditions needing urgent treatment. So recognizing and acting on it can be life-saving, whereas ignoring it could be catastrophic. So rest breathlessness should never be ignored. So acting on rest breathlessness can be life-saving. Let me address the anxiety point carefully, because it's important not to misattribute. Let me address anxiety carefully. While anxiety and panic can genuinely cause breathlessness, and panic attacks are real, it's important not to assume breathlessness is just anxiety, especially the first time in older adults, or in those with heart or lung risk factors, because the symptoms can overlap with serious conditions, and you can't reliably tell yourself. So breathlessness should not be dismissed as anxiety without proper assessment, and any breathlessness with concerning features, chest pain, bluish lips, severe or sudden onset, warrants emergency care regardless. If you have a known diagnosed anxiety or panic pattern, follow your doctor's guidance, but any new, different, or concerning breathlessness warrants caution. So don't assume breathlessness is just anxiety without assessment, since it can overlap with serious conditions, and concerning features warrant emergency care regardless. So don't misattribute breathlessness to anxiety without assessment. So anxiety shouldn't be assumed for breathlessness. Let me be clear about what to do, because the response should match the breathlessness. So here's what to do. For sudden or severe breathlessness at rest, or breathlessness with chest pain or pressure, bluish lips, severe distress, fainting, or frothy pink phlegm, call emergency services immediately as a possible emergency. For new, significant, or persistent breathlessness at rest that isn't an immediate emergency, see your doctor promptly to find and treat the cause, whether heart, lung, or other. For breathlessness with other heart failure signs, like ankle swelling and fatigue, or breathlessness lying flat or waking you at night, see your doctor, as I've discussed. And don't ignore or downplay breathlessness at rest, or assume it's just anxiety or aging without assessment. So call emergency services for sudden or severe breathlessness at rest or with chest pain or bluish lips. See your doctor promptly for new or significant rest breathlessness, and don't ignore or misattribute it. So match your response to the breathlessness, never ignoring it. So respond per the breathlessness, urgently when severe. Let me paint you a quick picture of how this matters. Picture a woman in her 70s who, sitting quietly one evening, suddenly becomes short of breath for no reason, struggling to get enough air, with a little chest discomfort. In the dangerous version, she tells herself it's just anxiety or her age and waits, not realizing this sudden rest breathlessness could be a heart problem, a lung clot, or another emergency, and the delay is dangerous. Now picture her understanding the significance. Knowing that sudden breathlessness at rest, especially with chest discomfort, is significant and can be an emergency, she calls emergency services immediately and is assessed and treated for what turns out to be a serious but treatable condition caught in time. The same woman, but treating her sudden rest breathlessness as the important symptom it is, rather than dismissing it, got timely, possibly life-saving care. That contrast is exactly why recognizing this symptom, and never ignoring it, matters so much. Let me speak briefly to those of you caring for an older parent or partner. Understand that sudden or significant breathlessness at rest is an important symptom that can signal a heart problem, like heart failure or a heart attack, a lung problem, a lung clot, or other serious conditions, and should never be ignored or assumed to be just anxiety or aging. Crucially, treat sudden or severe breathlessness at rest, or breathlessness with chest pain, bluish lips, severe distress, fainting, or frothy pink phlegm as an emergency and call emergency services immediately. For new or significant rest breathlessness that isn't an immediate emergency, encourage seeing the doctor promptly. Watch also for accompanying signs like chest pain, ankle swelling, or breathlessness lying flat. Don't let a loved one downplay or misattribute breathlessness at rest. Helping a loved one recognize and act on this important symptom can catch and treat serious conditions and save their life. So let me draw this all together. Suddenly feeling short of breath at rest, when you're not exerting yourself, is a significant symptom that should never be ignored, because, unlike exertional breathlessness, it means the heart or lungs aren't coping even without exertion. It can signal heart problems like heart failure, a heart attack, or a rhythm problem, lung problems like a flare of asthma or COPD, pneumonia, or a blood clot on the lung, or other causes like severe anemia. And, while anxiety can cause breathlessness, it shouldn't be assumed without assessment. Crucially, sudden or severe breathlessness at rest, especially with chest pain, bluish lips, severe distress, fainting, or frothy pink phlegm, is a medical emergency. So call emergency services for these emergency situations, see your doctor promptly for new or significant rest breathlessness, and never ignore or misattribute breathlessness at rest, since acting on it can catch and treat serious conditions and save lives. So here's what I'll leave you with straight and clear. First, understand that breathlessness at rest, when you're not exerting yourself, is significant because, unlike exertional breathlessness, it means the heart or lungs aren't coping even without exertion, so it deserves attention and should never be ignored. Second, know the heart causes. Heart failure, a heart attack, rhythm problems, and other heart conditions can cause breathlessness at rest. Third, know the lung and other causes. Lung conditions like asthma or COPD flares, pneumonia, a blood clot on the lung, severe anemia, and anxiety can too, so it warrants proper assessment. Fourth, and crucially, treat sudden or severe breathlessness at rest, or breathlessness with chest pain or pressure, bluish lips or face, severe distress, fainting, or frothy or pink-tinged phlegm, as a medical emergency and call emergency services immediately. And fifth, see your doctor promptly for new, significant, or persistent breathlessness at rest that isn't an immediate emergency, to find and treat the cause, and don't ignore, downplay, or assume breathlessness is just anxiety or aging without assessment, since the symptoms can overlap with serious conditions. Sudden breathlessness at rest is an important symptom that can signal serious, sometimes life-threatening conditions, so recognizing it and acting promptly can be life-saving, which is genuinely important. So take care of yourself. Never ignore breathlessness at rest. Act urgently on the emergency features, and see your doctor promptly for new or significant rest breathlessness. And because sudden breathlessness at rest can signal a heart attack, severe heart failure, a lung clot, or other serious conditions, Please treat sudden or severe breathlessness at rest, or breathlessness with chest pain, bluish lips, severe distress, fainting, or frothy pink phlegm as your reason to call emergency services immediately and see your own physician promptly for any new or significant breathlessness at rest, rather than ignoring it or assuming it's just anxiety or aging. This touches on a frightening symptom, so if breathlessness is troubling you, please know it warrants attention, and your doctor can help find the cause. And if it's sudden or severe or with chest pain, treat it as an emergency.